Paying for healthcare coverage in the United States is a concern for both individuals as well as for employers who are offering employer sponsored healthcare options, both for current employees as well as for their retirees. As healthcare costs continue to rise and the question of value continues to come into play, more and more employers are trying to get creative. Healthcare managers need to be aware of these trends, both in terms of how they can serve the patient populations that walk through their doors, as well as how they can afford to provide coverage for their own employees and retirees. On March 3rd of 2022, Fortune magazine released an article that was titled Seeking to Shift Costs to Medicare, More Employers Move Retirees to Advantage Plans. This article examines the trend over the last decade that have shifted retirees to Medicare Advantage policies rather than the traditional format of standard Medicare coverage with an employer sponsored secondary or supplemental policy to provide additional coverage. Experts say that this move is saving employers money because it is actually shifting the cost of that healthcare coverage over to the federal government. These Medicare Advantage policies are run by commercial insurance companies, and they do offer all of the same advantages of a traditional Medicare policy, but they do include additional perks as well, such as dental and vision coverage. For most employer sponsored retiree plans, the government pays the commercial companies a set amount of money per each Advantage member that is enrolled. Barry Carlton, who's the Senior Director of Health and Benefits at Willis Towers Watson, says that this leaves the government paying, quote, the overwhelming majority of medical costs. This is appealing to employers because it shifts that cost away from them. CMS has no data on the veracity of this claim or how many employers have engaged in this particular strategy because CMS is not party to the negotiations between the employer and the Medicare Advantage policy providers. The Medicare Payment Advisory Commission, however, which does advise Congress, is claiming that the government spends on average 4% more per Medicare Advantage member than a traditional Medicare member. While these policies may be costing employers less, it might also be costing the government more, and it may also be restricting healthcare access to retirees. Retiree Medicare Advantage policies have many exemptions that public Medicare Advantage policies do not, and it does end up leaving these retirees in a position where they have to either contact their previous employer, union, or the insurance company themselves in order to find out information that would regularly be made available to the public. And this leaves them with no third party or impartial party that they can get this information from. These Medicare Advantage policies may also restrict their coverage and access to doctors by restricting them down to a specific network. In New York City, some city retirees have actually sued in order to stop the implementation of the proposed New York City Retiree Medicare Advantage plan. They've cited issues both with the enrollment guide as well as coverage, saying that it has reduced their coverage from the previous policy that was allowed to them. The New York State Supreme Court has twice delayed the implementation of this policy in order to give the insurance company time to fix the enrollment guide as well as to reach out to more providers about enrolling in the policy to allow increased access. As of this video, the state Supreme Court has actually ruled to stop the implementation of the Medicare Advantage policy. This is currently being appealed.